Hey, are you going to write the post-BSc examination? Then this video is for you. Today I came with a video of important questions in nutrition and dietetics. So don't skip the video. If you are new to the channel, please don't forget to subscribe our channel and press the bell icon. This is Akhila. Welcome to Nursing Guru. On nutrition and dietetics, you will get the maximum mark of 35 and you will get the questions like long essay, short essay and short answers. Now we will move to the long essay type questions. On that you will get like A, B, C type questions. So we will move to the questions. First question A. Define nutrition. B. Explain the various methods of assessing nutritional status of an individual and community. Second question A. Define balanced diet. B. What factors do you consider while planning a balanced diet? C. Plan a one-day meal for pregnant woman. Third question A. Define malnutrition. B. List the causes of malnutrition. C. Explain the methods to be considered for prevention of malnutrition. Next question A. What are the macronutrients? B. Discuss the etiology and management of protein energy malnutrition. Fifth question A. What are fat soluble vitamins? B. Discuss the sources, functions and deficiency of vitamin A and vitamin D. Next question A. Define community nutrition. B. Explain the needs for community nutritional program. Next A question define dietetics. B. Explain the dietary management of hypertension patient. Next question A. Discuss the importance of nutrition education. B. Explain the role of a nurse in nutritional education. Another question, discuss in detail the importance of nutrition in health. Next question, discuss the balanced diet and dietary requirements for adolescent girls. Another question, list the nutritional problems in India and explain the role of a nurse in National Nutritional Program. Next question, define therapeutic diet and explain therapeutic diet for cardiovascular diseases. Next question A. Define protein energy malnutrition. B. Explain the different methods used for nutritional assessment. Next A. List out the principles of cooking. B. Explain in detail about different methods of cooking and its effects on nutrients. Next question, discuss the importance of breastfeeding. Explain the role of a nurse in promoting and implementing BFHI in hospital policy in the hospital or community settings. Next question, what is vitamins? Explain the sources, functions and deficiency of vitamin B complex. Another questions, functions of carbohydrate. Next, discuss in detail about the importance of nutrition in health. Another one, discuss the balanced diet and dietary requirements for adolescent girls. Another question, discuss on various deficiency diseases and method to prevent them. Another question, discuss in detail the dietary management of a patient with atherosclerosis. So these are the long essay questions. Now we will move to the short essay type. On that first question, ICDS program. Second one, food adulteration and its prevention. Third question, describe the factors to be considered in menu planning. Fourth question, explain the process of introducing supplementary feeding in infant. Next question, balanced diet in elderly. Another question, food standards. Next, describe the nutritional management of kwashiorkor and marasmus. Another question, nutritional status assessment. Next, growth chart. Another question, pasteurization of milk. Next question, breastfeeding and weaning. Another question is integrated child development scheme. Next question, discuss the routine hospital diets. Another, food hygiene and its effects. Next question, micro and macronutrients. Another question, nutritional problems in India. Next question, midday meal program. Next, diet for sick child. Another question, method of assessing nutritional status of a child below 5 years. Next question, method of cooking. Another one, high calorie diet. Next question is function of proteins. Another question, factors affecting meal planning. Next question, undernutrition. Another one, planning diet for lactating mother. Next question, bodybuilding food. Another question, preservation of food. Another question, BFHI, Baby Friendly Hospital Initiative. Another question, composition of breast milk and cow milk. Next question, therapeutic diet for the hepatic disorder. Another question, prevention of nutritional anemia. Now we will move to the next section of question, that is short answers. On that you will get the questions like food hygiene, dehydration, dietary sources of calcium, grilling, list the macronutrients, enumerate 4 signs of vitamin D deficiency, advantages of school lunch program, cholesterol, food additives, rickets, steaming, canning, BMI, dietary sources of calcium, whey water, scurvy, supplementary feeding, weaning, pouching, calorie, fiber diet, substitute for non-vegetarian food, low-cost nutritious food, FAO, functions of vitamin B12, obesity, source of iron, kwashiorkor, Prevention of Food Adulteration Act, iodine deficiency disorders, undernutrition, dietary assessment. So these are the frequently asked questions for nutrition and dietetics. If you are working on all the questions, I can make sure that you can score more. If you are having any doubts, comment below. So don't forget to download the Nursing Guru app. You will get more study materials on the app. We will meet you on another video.